So, I think it was maybe 3 or 4 weeks ago, first time I came in here. I was kind of skeptical about, my coworker just sent me here and said that, you helped her, but she had some shoulder pain. So I said, well, I mean, I didn't want to have surgery
On your
on my left knee because I had surgery years ago, 2002 or 3 before. So the first treatment that you gave me, the first thing I noticed when I stepped out of the office was that I could go downstairs.
and how long has it been before you could do that?
I had the injury, I think it was in June. I mean, I've always had a little pinch of something, but then when I knocked my knee there, I mean, I tried some anti-inflammatory drugs. I was sent to a orthopedic doctor, and it was just going the route of surgery. But it took me years to recover from the last one I did.
Okay.
The first one I did, so I didn't want to go there.
So you had arthroscopic surgery.
I had arthroscopic surgery on that knee, and
Took you years to recover?
It took years. I had to change. I was a medical nurse. I had to change my
whole life.
To go into psychiatric nursing, which required a lot of sitting down, talking to patient.
So you changed your whole life.
Yes, I did. And so when this one was like going, I knew that maybe that was the end of my nursing because in my hospital where I park is so far away, and walking down there was just. I mean, I was limping and it was affecting my hip. I was like, well, I'm 60, maybe a few more months, then I will just stop working. I've put in my time.
Wow.
And otherwise I'm healthy and vibrant,
Yeah.
But that knee, I have to walk.
Yeah.
So that first treatment, I was, when I go downstairs, I go one stop. I was able to extend it. I was like, okay, this is okay, kind of like. But I started that night. I think the thing that really got me was I also had arthritis. I mean, my right leg I was just wrote off as maybe someday I would do the knee replacement. But the one that bothered me more was my left.
Okay.
My right had already, I knew was done. It was just a matter of when can I go and do that. And I usually have cramps on my right thigh at night. So that night I didn't have the cramp. I mean the little pain that's deep inside me. I didn't have that. I woke up the next morning, I was like, well, I don't know, but I'm just skeptical. This doesn't make any sense to me, but
You thought it was all in your head.
I thought it was in my head.
Yeah.
So I went to work 2 days afterwards, and I was not limping. I was walking. Okay. I came back there and I've just hugged my coworker and danced with her. I'm like, I don't know about tomorrow, but today I feel good.
So now you said, this is your third visit, right?
This is my fourth visit. This would be my fourth visit. The second week, though, I didn't have any much change. I mean, it was like my first week was better than the second week. I still had the tightness on my knees. Well, what you call joints, hinges. So but the third one was last week. I noticed that throughout the day I didn't have the pain dip, but I also did the massaging, Yes, I always massaged me. But on Thursday, this last Thursday, I felt the best I've ever felt in years. I mean, years. I was walking, my stride was like
normal.
I was like, I feel like I could just skip, and I was actually,
I know. It's hard to believe, isn't it?
I don't know.
Because you had basically, in your mind, had projected into the future that you'd be
Oh yeah.
crippled.
Oh yeah. Oh yeah. It was just, I was just maybe a little time, just maybe a few months. I mean, because this has been going on since June. It never got better.
Mm-hmm.
Even with anti-inflammatory drug, I would take it. It gets better than
Now, did the orthopedic doctor tell you anything about alternatives?
No.
Acupuncture, myofascial release, or needling, or anything?
No. That's no. What I was, the reason I didn't get, because I just saw him once and he was supposed to send me to an MRI. He sent me to an MRI, but the insurance initially rejected it. And in between that rejection, I thank God for that. Because that's when I was like, okay. I mean, I was going to call them and fight it, but
Okay.
they gave me time to.
Okay, so I'm going to put this on my links, and is it okay if I?
Absolutely. I wish I'm telling my husband to come here, but with Medicare and all that.
I know, I'm having a problem with Medicare denies the treatments that I'm giving you for the elderly.
That's not right, because when you think about the cost that it could have cost me to do all the things I would have done, I mean, I feel good, doctor.
Okay.
I feel really good.
Great.
I
Thank
feel
you.
good. And I'm not doing this because, I feel really good.